Okay, lots to discuss this week in the fight against COVID-19. I want to bring in our medical expert, Dr. David Winter from Baylor Scott and White Health. Okay, Dr. Winter, so new reports this week confirm immune protection from the Pfizer vaccine starts to diminish several months after injection. So can you clarify, first of all, is that the second injection? And then what do you make of this? Are you seeing vaccinated patients get seriously ill months after getting the Pfizer vaccine?
Yeah, that's the important question, Sonia. I've seen a lot of folks 7, 8 months after their second vaccine, so fully vaccinated, but 6, 7, 8 months out, they get COVID and they have a very mild case. So I can't tell any difference from those folks. Now, the studies you referred to came from Israel and Qatar. They measured antibody levels. And we know the antibody levels tend to go down after you get the vaccine, first one and the second one. The second one gets it way up and they start to decline then 2 months later. But it doesn't seem to affect sickness. In fact, the studies emphasize the fact that it's still you're protected against serious illness, deaths, hospitalization if you've been vaccinated. Boosters is another thing. When do we need to get a booster? They're currently recommending 6 to 8 months out, but we know from that point on you're still fine. You're still good at this point, Sonia.
Well, yeah, and the booster's not for everyone, but sticking to that theme of the Pfizer booster shots, those were given the green light. I personally know a lot of people who've already gotten them. They're fine. But for the people who didn't get Pfizer's COVID-19 vaccine initially, where does Moderna stand? Where does Johnson & Johnson stand with regard to booster shot authorization?
No reason to think they won't also be approved for that. It hadn't happened yet. We're thinking a couple weeks away. Now, England, interestingly, has said, well, you can mix them. They give AstraZeneca and then Pfizer. It seems to work. But in this country, it's not recommended that you mix those. So for those Moderna folks, J&J folks, the official recommendation, wait till the booster is approved and get the same vaccine from the same company.
Yeah, I think there will be a lot of interesting information that comes out of all of the meetings that will happen later this month, which leads me to want to talk about children, because I know a lot of parents are watching, waiting, listening. What is the timeline for these 5 to 11-year-olds to get the Pfizer vaccine, or I guess become eligible to get it?
Yeah, there's a meeting scheduled the end of this month. That recommendation is of a small committee that will recommend to the FDA. The FDA usually accepts that recommendation, so it should happen by the end of the month. Already, as you know, children aged 12 to 15 can get it by emergency use authorization from Pfizer. And of course, the Pfizer vaccine has always been fully approved now if you're age 16 and older. So we're moving down. Younger than that, that's still to be seen, probably November for the folks less than 5 years of age.
And Dr. Winter, I want to kind of pivot a little bit and talk about flu, because last year, you know, we didn't see much flu, if at all. What do you expect this year? And I do think it's worth explaining how we usually predict our flu seasons in this country, sort of by looking at what's circulating elsewhere.
Yeah, that's a very good question. So there wasn't hardly any influenza last year in this country, so not any natural immunity out there. So I'm very concerned it's going to be a major outbreak of influenza. Influenza plus COVID, dangerous combination. Now, they look for, in years past, to figure out what strains they want to put in the current vaccine. So I'm not exactly sure how they did it this time. They've got 2A and 2 influenza B strains, so 4 strains in the current flu vaccine that's out there. They predict this is going to help. Is it the exact one? Well, it's their best guess right now. I do know folks that get a flu shot every year do better than folks that get one sporadically. You build up some continual immunity there. So my recommendation is get a flu shot this year over any other year you've gotten one, and the time to get it is now. October, November are the months that you should get the shot.
All right, Dr. David Winter, thank you so much for your time today. Appreciate it.